I'm Dr. Sharath, a cosmetic plastic surgeon at KIMS Kondapur, and today I would like to speak to you about hymenoplasty. Hymen is a pink thin membrane which lies about a half inch inside the front passage, that is a vagina. And hymenoplasty is restoring its form. If it is torn, restoring its form. Basically, if you have a torn hymen, which could be due to various reasons, one physical trauma or heavy exercise, use of intravaginal tampons or after sexual intercourse, this torn hymen can be restored. I would suggest that you speak to a plastic surgeon who is experienced in doing this work, and then take his advice on the surgery. And if you are entailing on it for the reasons that you are convinced about, then it would also involve discussion about the anesthesia, which would normally be a local anesthetic. Unless you are anxious, then it would involve a general anesthetic. The procedure itself might involve a local anesthetic, as I mentioned before, and the torn hymen is repaired by either means of creating a flap or creating a narrowness in that area. After that surgery is done, there could be a little bit of bleeding, and you would be advised to avoid swimming in open baths for the first 2 weeks, avoiding intercourse for the first 2 months, and by about 3 months you would notice that the hymen is well formed and physically also visible, apart from being functionally be stronger. Basically, the individual who is having this surgery will have a hymen, which is basically a thin membrane in the front passage of the vagina. At the time of sexual intercourse, sometimes when it is torn, you might not get a bleeding, and people need to be aware about that. But physically, the hymen that is reconstructed will give the individual who had this surgery a feeling of being restoring their virginity. Hymenoplasty, for the reasons that it is being done, which could be a penetrating injury in that area or abuse which results in hymen being lost, would enhance a woman's confidence about being restored after being restored, and being functionally more happier.